Pediatric Executive Development System, or PEDS, is a dynamic, transformative program designed to accelerate the growth and development of the leaders in the field of pediatric entrepreneurship. PEDS takes a hands on approach to problem solving, addressing real time situations within your organization. More than a theoretical course, it is a practical platform that accelerates learning. Look at our link on the show notes for more information. Good morning, George. It's Tuesday morning. It's good to see you again.
How you doing, Dr. Bravo? Today we have another wonderful guest. Just so happens to be in our neck of the woods here on Long Island, Dr. Eve Meltzer-Krief. And her topic of discussion for today is going to be a pediatrician running for elected local office. Should
Dr.
be
Eve,
interesting.
a Democrat from Centerport, is running this year for Suffolk County Legislature, District 18. After growing up in Queens, Dr. Eve moved to Town of Huntington in 1999. She has raised 2 children with her husband, who is also a doctor. Dr. E has become a practicing physician in Huntington Village Pediatrics for nearly 25 years. She has been a very effective advocate for children's health needs, including gun safety, vaping, vaccines, and food insecurity. Welcome to the show, Dr. Eve.
Thank you for having me.
We always start the show by asking, why did you become a pediatrician?
I love my job. I love being a pediatrician, and it's what I've always wanted to do. Ever since I was a little girl, that's what I knew I wanted to do. I have my dolls and stuffed animals lined up on my bed and have my office and have a little bell on my door. People would ring when they came to my office, and my little clock radio set to like music, and and I would examine them from my own little pediatric office. It's always been my dream, and just I love children, and I just really just very blessed to love my job. I think it's a blessing in life to enjoy what you do for most of your day when you're not at home. And I truly am blessed to love what I do.
Yep.
You have a wonderful story about your grandmother. Actually, and it was your grandmother, right?
Actually, my mother.
Your mother that was in Paris during the Holocaust. Would you mind sharing some of that story? I think it's very important in light of the world events today.
Yeah, absolutely. And her story is really what inspires me to do everything I have to be as outspoken as I have these last 3 years. We're Jewish, and my mother was born in France. And when she was 5 years old, her parents sent her to the Friends of a Christian home in the French countryside to hide. She had 2 older sisters in their teen years. And she never saw her 2 parents or her 2 older sisters again. And she was orphaned when she was 5 years old. And she went to a French Jewish children's orphanage where she lived. And when she was 17, she had an aunt that found her in this country. I've known her story ever since I was a little girl. It's always been part of who I am and carried that story with me. And she always taught us growing up to never forget it could happen again. Never quite believed that, but carried it with me. And she always taught me to never be silent in the face of injustice and that silence is complicity, and always carry that with me as well. All these years just seemed to me that people who knew better than me that were in charge of government where things seemed like they were 2 steps forward, 1 step back, but going in the right direction. We had marriage equality. We elected our first Black president. We passed the Affordable Care Act. So things seemed like they were going okay. And then over the last good number of years, things started taking place across the country that really troubled me. And I just found myself, even though I'm like, I guess I would call myself a rather shy, maybe more introverted person than not, found myself unable to stay quiet about a number of things going on across the country. And I think that's what led me here, because as an advocate, a legislative advocate and a community organizer and activist, I'm one of hundreds of people, right, raising their voices and trying to make their voices heard by legislators at the county, state, federal level. And when you're an actual legislator, you have a much more powerful voice to be that advocate and to push through legislation and use your voice, sure, for good. I think it's her story that really has led me to this place.
Yeah, I think it's a story that right now we must not forget. And
100%. It's really troubling how quickly our what's going on in the world has morphed into anti-Semitism. And it's just really frightening how quickly that's happened. And we had swastikas out in Montauk, and
Really?
our college students. I've got a daughter in college right now, and it's just super, super troubling. Yeah, there are no Jewish people in the county legislature right now, actually, that I'm running for. And I think that my voice will be a needed one there.
It's foolish to repeat the mistakes of history. And I think you're right. Silence is acquiescence. And you become part, even if you may not mean to, you become part of the problem.
You don't raise your voice, you are part of it.
Um, why are vaccines so important to children, and not only children, but to all of our health?
Yes, everything that I was taught growing up in a home that values science and everything I've learned as a pediatrician, I believe that vaccines still remain like the greatest accomplishment of the 20th century and saved millions and billions of lives. And growing up, you went to your doctor and people weren't didn't have access to the internet back then. And there was a greater level of trust, I think, in respect for the medical community. But with a lot of disinformation that spread over the last 20, 25 some odd years, and the advent of social media, that spread of disinformation has really just snowballed. And it's led to vaccine hesitancy that the WHO has actually called one of the greatest threats to public health in the world right now. Here in New York State, we saw the huge measles outbreak just before the year before COVID hit. Everyone forgets about that, but my husband works in the pediatric emergency room, and offices like mine had to have signs outside their offices. If you have a cough, runny nose, conjunctivitis, don't come in. And we had to go outside to see them, and they had them the ERs to see patients.
For more information about measles, look at the Pediatric Lounge podcast episodes with Dr. Paul Offit, Cough, Colds, and Chickens, and our episode on measles with Dr. Marianne Jackson. I also would point you to our episode with Dr. Leah Gagino on the pediatric meltdown, as we address specifically the dangers of misinformation and the miracles of vaccines.
Wherever you see levels of vaccine hesitancy rise, disease outbreak like we had in Ohio earlier this year, which took in hundreds of children, American Samoa, you saw children dying. And across the world, you have unvaccinated children all over the world in other countries. And these days, that's just a plane ride away. So I think that vaccines are the victims of their own success because parents these days don't know the harm that these diseases can cause. Serious, hospitalization, the injury, the death. And there's just a lack of understanding of what we're really trying to do and how we really do need a certain level of the population vaccinated to prevent the spread of these diseases. So I think it's important to push back against the disinformation. I think that's one of my primary responsibilities as a pediatrician because pediatricians are the foremost experts in vaccines. We give them more than any other type of our physician. And I think it's our responsibility trying to educate the public patiently, understandingly, addressing their concerns that they might be hearing across different platforms and just really pushing back against the anti-science because it's real, it's powerful, and it's dangerous. So we really have to do all we can to fight it.
I think the problem with the vaccine hesitancy came about because, again, from the success of the vaccines, they label these illnesses as childhood illnesses that the children do good. The chickenpox parties, not that big of a deal. And that extrapolates into other illnesses like COVID illness.
Right.
I can tell you one thing. I am a measles expert because I had measles in 96 as an intern working in the emergency room.
Wow.
If you look it up, 1996 Jersey City epidemic of measles, I probably was focused patient number one because I was working in the ER. Picked it up. We would admit these children just like your husband.
Yep.
They were sick. Some of them were really sick. 106 fever, 106.
Yep.
Really?
And people need to understand that, although, most children do well with these, right? Just like today, what we're seeing with COVID, right? Most children do very well. Most adults do really well. You're sick, it's miserable. However, children aren't supposed to die.
Yep.
So if the vaccine's going to save even one child that would otherwise have died, that's a success, right? That's what we're trying to do because they work and they're safe and they save hospitalizations, they save serious illness, they save children from dying. And that's what we do. And these chickenpox parties, people still talk about that. But in residency, I saw children it was rare even when I was in residency because the vaccine had just come out. We saw children with encephalitis. I saw a child lose a limb because she had a staph infection. Things still do happen. And that's what the vaccines prevent.
Yeah.
Know that.
Even before social media, we had Robert F. K. Jr. suing people and misinforming people and getting paid to propagate lies about vaccines.
Right. And a lot of the disinformation comes from groups like that who are profiting off of this information. And it's really troubling.
He is a dangerous man. And people should always keep that in mind. But we also have now a failing government in many instances. For example, it's hard to convince somebody to take the COVID vaccine for a fifth time in a healthy child when they've already had it twice. If I came in here and I told you the kid's got chickenpox and you draw his titers and he has, would you give him a chickenpox vaccine? No. Then why would you want to give him this one? A fifth time. They've already had it 3 and they had 2 natural
Right.
infections.
Yeah, you go by what they're recommending. If the child's already had 2 vaccines, then you don't need to check the titers.
You asked me, I was measles expert and I had measles. Dr. Rogu, you're of age. You probably should have had the measles vaccine. Yeah.
That the titers
Yeah.
waned.
The titers waned. Exactly.
Without those vaccines, you might have gotten even sicker, right? Like with the flu
Probably.
vaccine, we encourage children to get every year because children under 5 and even more so children under 2 years old, if they get the flu, can get very sick from the flu. Now,
Yep.
everybody knows you can still get the flu if you had the vaccine. Point isn't to prevent you from getting the disease, it's to get getting very sick from the disease. If you take the flu vaccine, if you do get the flu, you're 50 to 60% less likely to get seriously sick or die from the virus contracted. So that's the point of vaccines, just to prevent the risk of death.
You're honest. This isn't going to stop you from getting the flu or spreading the flu around. What it's going to do is it's going to make you 50% less likely of ending up in a hospital floor miserable for 2 weeks with that secondary pneumonia.
And it will decrease the risk of spreading it around because you will be less likely to get it and less likely to be contagious when you do have it. So it will prevent the spread. And also with the flu vaccine, when young children get it, they're the ones who spread to the elderly who are getting sick. So if you can stop it from children, really.
This discussion right here, I think, is this discussion. That message is not translated out to people and people can't understand what you said.
It's very hard to fight the disinformation. There also, it's much more powerful. So voices like ours are drowned out, fortunately.
Important thing is, as you've said several times already, the important things is that these vaccines save your life. If I've had COVID twice after 3 vaccinations, and I hate getting COVID, I get really sick. But you know what? As I'm laying with 102 fever in bed, I go, if I hadn't had vaccinations, I'd probably be in the ICU intubated in a diaper and leave the ICU to a nursing home because I live alone. I wouldn't be able to walk because my muscles would be totally wasted after 6 weeks of ICU care. So it's miserable. The vaccine didn't fail. It stopped me from even entering the hospital,
Right.
from being in an ICU bed for 6 weeks and then a nursing home for 3 months for convalescent. Sometimes the message gets muddled and people's expectations are that I am just not going to get sick. And then when they get sick, they lie to me and this doesn't work. So that's been a problem with this. It also was a problem before this, right? It's not a vaccination. It's a monoclonal antibody and it was poorly rolled out. And then now we don't have enough doses for the parents that want it.
Right.
And
There's
just
we're not even, no, we're not, it used to indicated for 8 months and up and under, and now we're supposed to give it to 6 months and under, and only to children with certain conditions. Yeah, there's a national shortage of that rollout, which is really troubling. Yeah.
And over deliver because you lose credibility.
Yeah, we had told patients initially, we learned that it would be sporadically available because this is the first year of the rollouts. Yeah, that's unfortunately by next season, we'll have something ready to go.
Now, you had a terrible experience in your office that was quite frightful with anti-vaxxers.
Yeah, I've been targeted by the anti-vaccine community, mainly because of my advocacy work on the law that passed in New York State in 2019 in the height of the measles pandemic. That was it removed the religious exemption to vaccination because a lot of people there are no religions that say that you can't get vaccinated. But there were people who were claiming a religious exemption just to not get their children vaccinated. And that led to a less than 95%, in some cases 70% vaccination rate against like measles, where you need a 95% vaccination rate to prevent transmission in populations. That's something that the American people really encourage that to remove religious and philosophical objections to vaccination around the country to prevent these outbreaks like we've been seeing. And so I was outspoken on that, and I just, it has definitely earned me the ire of the anti-vaccine community. They came to my office and had a rally outside my office and went up to young parents holding their infants, asking them to vaccinate their babies and their children, and left anti-vaccine literature in all the cars. The following spring, we went to Albany. Every year we have a legislative advocacy conference in Albany just to push for things like early intervention and Medicaid coverage for children, the legislators. And they had found out about this advocacy conference and organized a huge anti-vaccine convention of sorts when we had ours, and just followed us around. They made these graphics of me and my colleagues' faces and calling us Farmer Show. And throngs of them followed us all around Albany, shouting in our faces, "Baby killers!" And we had to get the Capitol Police to protect us. It was really unnerving, and they call me Dr. Evil. A plan on my name, but it's really troubling.
Yeah. Something similar happened to my office when we were one of the first offices to give the COVID vaccines. First, we gave it to adults because through our clinically integrated network, we were able to collect a lot of vaccines and redistribute it to the smaller solo practices.
Right.
And then, so we were perfected at the adults. And then when the kids were available, I thought we were doing a good thing. So on the first day, we made a big deal about it that we're giving the vaccines. People were lining up to get the vaccines. We took some pictures of the doctor's kids on Facebook. Do you know what happened? Baby killer,
Yeah.
blood on your hand.
Yeah.
I had to shut it down. It made me feel like so bad.
Yeah. I'm on my school board in my school district. I ran in 21. I wanted just to, I thought it was an important time to have a pediatrician on the school board just to make sure things were healthy and safe and happening the way they needed to happen. And they were. But I've been attacked on nearly every board meeting by a small minority group of very loud anti-vaccine communities saying that I have a conflict of interest as a pediatrician being on the school board because I push this, claiming that I make money. Meanwhile, we made that of COVID vaccines and that I have a conflict of interest. I push this into our children, and I've been attacked on social media. It's been said that I should be put on trial for pushing this poison into our children, and if found guilty, I should be executed. That's the kind of attacks I faced, and I'm not gonna back down. That only makes me push back harder because I think that we really do need voices of reason and voices of science, and it's important.
Despite all of this, and I guess it's because of your mother's experience, you still want to run for elected office?
I think more than ever, I think it's important to have voices of reason right now. There is so much disinformation, there's so much hate, there's so much vitriol. And I've always worked to bring people together. After Charlottesville, I was very troubled to see men in carrying torches screaming Jews will not replace them. So I worked to form a group called Long Island Inclusive Communities Against Hate, because I think we're seeing this polarization of hate, right? It's the same thing with the vaccines. It's polarization of hate, really. And that's with science being politicized. That's why so many people were on anti-mask and anti-vaccine. And millions of people died from COVID that didn't have to, right? It's really troubling. But with that other group, the Long Island Inclusive Communities Against Hate, just to bring together elected officials of both parties and educators and community members and clergy, just to stand together against hate whenever we see in our communities. And I was appointed to the Town of Huntington Anti-Bias Task Force, where I've been an outspoken voice against hate, led a project called the Hate Has No Home in Huntington Project, where we had alongside the Hate Has No Home in Huntington and business graphics to put in storefronts where hate has no business in Huntington, and just worked hard to bring different ethnicities, culture, particularly children, together. Because whenever they come together for volunteer projects, they always learn that we have so much more in common than not. And that voice is going to be particularly important right now with all the hate and vitriol we're seeing right now, particularly against Jews right now.
Unfortunately, it's so confusing, right? Like both extremes on the left and the right are spewing hate, and it's odd to see Kennedy allying himself with some extreme right people to bash vaccines. It's an odd sort of bedfellows, and I wonder what part do we who try to be a little bit more reasonable play in inciting that or pushing back against it? Because it takes two to fight, right?
Right.
With Kennedy on that, don't vaccinate your kids for measles. But what part, how can I better tailor my message not to offend and still listen to?
And I think pediatricians, obviously, we bring a more authentic voice to it because we're not politicians. And just whenever people have confronted me on social media in a hateful way with disinformation, I always counter never with the hate back, just stating fact. And linking resources and just sharing the resources like the Vaccine Education Center from the Children's Hospital Philadelphia, which is an excellent resource for everything vaccine. And just trying to respond to it all with fact, with grace, with empathy from when they're coming from, and understanding the misinformation that they're confronted with, and just to try and just look at that way.
Yeah. And now you're also a big advocate for safety. Why is water, bike, car, and gun safety so important for children today?
All these things impact the health and well-being of our children. And gun violence is really the number one killer of children and teens in our country right now. And to us as pediatricians who literally work every single day to give anticipatory guidance to parents to teach them how to keep their kids safe, to give them vaccines, to keep them safe, to have something as preventable as gun violence be the number one killer of our children is just horrifying and embarrassing because we're way ahead than anybody else in the Western world with that kind of mortality rate. It's really horrifying. So I've been outspoken on that because there are data-proven things that we can do. Universal background checks do work. We know that safe storage. I was very outspoken to get safe storage passed here in New York State, which requires that guns be stored separately from the ammunition and they each be in a lockbox, right? Because if a teen knows where his parents' guns are, if he's suicidal, and we know that they can be very impulsive, if he gets his hands on a gun, he's much more likely to be, he will be successful if he gets the gun rather than trying some other means of suicides. We've heard of so many tragic accidental shootings from young children just playing with their friends with their dad's gun and they get shot. These are really tragic, preventable deaths in children. So I'm very outspoken on that. I have a Mom's Demand Action Candidate of Distinction. I've spoken up with joined with the March for Our Lives kids, spoken at their rallies and just organized rallies locally and written op-eds. And I'm endorsed by Everytown for Gun Safety, which is unusual for a local candidate like myself, but I'm very outspoken on that. And as our water quality, when it comes to our environment, the water that our children drink, the air they breathe, and the effects of climate change, as vulnerable as we all are, children are that much more vulnerable because they're still developing, right? Their brains are still developing, their bodies are still developing. They're uniquely susceptible to the effects of climate change. They breathe faster. And these are issues that we as pediatricians need to focus on because climate change is here and the environment is getting worse. Locally in our area in Suffolk County, the water quality is worse than it has ever been. And it's been studied by scientists for years, and it's overwhelmingly due to our septic tanks, our cesspools. They're outdated. They leak nitrogen into the waters, and the nitrogen triggers algae blooms, which can be toxic. And the algae also sucks up the oxygen from the water and kills the fish and plant life. And that's why you might have seen more and more beaches closed this summer in our area because the water, you just can't go into it. The scientists have studied a fix to it as well, which would involve updating our septic system to fund sewer projects throughout the county. And that would be very expensive, however. So we have a very unique and time-sensitive opportunity right now. The federal government, through the infrastructure plan, has offered us billions of dollars in potential grant funding to update our septic sewer project. And the state's going to match any funds we raise as a county. And so that was something I was really advocating for because those grant funds, the federal grant funds, they can go into other parts of the country, right? They're not just in a little box that says Suffolk County on it waiting for us. And the state funds can go to other parts of the state. It's very important to advocate for that. Unfortunately, our county legislature decided not to put a referendum to establish that water quality fund on the ballot and really playing around with squandering of this very unique and time-sensitive opportunity to clean our water for our children so they can safely go in our water for decades.
Pediatric Executive Development System, or PEDS, is a dynamic, transformative program designed to accelerate the growth and development of the leaders in the field of pediatric entrepreneurship. PEDS takes a hands-on approach to problem solving, addressing real-time situations within your organization. More than a theoretical course, it is a practical platform that accelerates learning. Look at our link on the show notes for more information. Pediatrician and are interested in mental health issues and how to think about them, I recommend that you listen to my good friend Dr. Leah Gagino's podcast, The Pediatric Meltdown. She does a phenomenal job of interviewing key thought leaders in the arena of pediatric mental health, everything from gun safety to suicide prevention to anxiety to eating disorders, and then some more. You can find the link to some of her podcasts in our link below, but I especially recommend her podcast with Wendy Hunter from the Pediatrician Next Door. Check it out. So back to guns a little bit. The importance of gun safety is, to me, just wear a helmet when you ride your bike. You don't let a child swim in a pool by themselves. Well, you shouldn't even let an adult swim in a pool by himself. If you're near any body, if you're going to get in a boat, put the life vest before you get on the dock, because you never know.
Common sense gun legislation. Absolutely.
Things like you wear your seatbelt. You just don't wear your seatbelt when you know you're going to get in a car accident. If you could predict when you're going to get in a car accident, then you wouldn't get in the car that day and drive. You can't. So we put airbags and we put a seatbelt on. But these are just, I think, common sense things to avoid tragedy, because we've eliminated the infectious disease, as you mentioned, with the miracles of vaccines over the last 50 years. It's a pity to lose a child to an accident. And Sandy, president of the AP, describes how she once went into her family's Chinese restaurant and her child was playing with a gun on the floor. And these are good folks. It's just someone stuck the gun under the bed because they thought it was safe. And children tend to crawl through every hole in the house and find everything that's dangerous. And when I had a young child at home, I took all the bleach, anything that could be poisonous, I put it on a top shelf in the garage because I'm paranoid. And I a high thing on the door that goes to the garage.
Yeah,
where
the 6-month checkup, we start talking about how to keep the house.
we couldn't. It's just I have to go to the bathroom like every human being. And I got a 2-year-old walking around the house, opening every cabinet to see what he can, and they're exploring. So anything they find, they're going to play with. They're going to put it.
Yeah.
And
I'm really proud of the advocacy work I did here in New York State to get the safe storage law passed here. But it's crazy that this law isn't in every state. Like, why wouldn't you have this law? Like, why wouldn't you have this law? It's just
some people don't like to be told what to do, but we can still urge them. And I think if we're kind with our words in the exam room, I think we can still make a difference. Laws are one way, but I think I tell pediatricians throughout the country every day, we have an audience of 70 million that comes through our exam rooms every year. Not even Joe Rogan has an audience of 70 million. And we're much more trusted than Joe Rogan. So your words really matter, even if you can't get a legislation passed, if we are mindful and kind with our words.
And even with the law in place, there's still people who aren't safe storing their weapons. And so at every checkup in the emergency room now, even in New York State, that's one of the questions that we ask. Do you have a condom at home? And is it start safe? Some point reinforcing it.
There's still people that put their kids in the back of pickup trucks.
Right.
I can only
best, right? You can only just share the information, share the data, and encourage and hope that every day it works.
Yeah. Now, what is the harm of vaping in children and adults?
Children's brains are still developing until they're 25 years old, right? And those addictive parts of the brain that foster addiction are uniquely susceptible to the effects of nicotine. And one vaping product, Juul, is equivalent to an entire pack of cigarettes, right? So if a child's vaped like 3 times, they're addicted. They're already addicted, right? And it's very hard to treat that kind of addiction just because the patches that you don't know how much nicotine, the level is so variable with each pouch, how much nicotine you're getting. It's very hard to treat. So we have these, and also we have a mental health crisis right now, and that impacts their mental health as well. And we see that it's a gateway, right? So vaping nicotine is a gateway to vaping cannabis, which is not your parents' cannabis, right? It's very potent stuff there. And also they say it's not addictive, but it is.
Now it's legal.
And it's legal, right? And with the American Pediatrics, before it was legalized, we saw it was on the horizon, this was coming, and we had a 2-pager that we were sending to all the legislators in New York State. Please have these things in place before you legalize cannabis, because our children are going to be at risk. And unfortunately, it was rolled out very quickly without those protections in place. We really have that needs better enforcement. Children definitely getting into not just the nicotine now, but the cannabis and the dangerous forms of cannabis that can be laced with other drugs. Edibles are a huge problem right now because they look like gummy bears, they look like candy, they look like Doritos. And there's been a 1,400% increase in the ingestion of edibles by toddlers and young children in just the last 3 years. And again, my husband, pediatric emergency room, that all the time that these children come in up time dish and no one knows what's wrong with them. And then it's dangerous, right? And so there's been a bill sitting in the Suffolk County Legislature that would have banned the sale of child appearing packaged edibles, that they would just require them to be sold in opaque packaging. I think that law should also say, the bill should also propose that it be resealable childproof, right? But that keeps, it's tabled. They keep tabling this bill. My Plums and Health Committee keeps tabling this bill. And why wouldn't you do that? Like, these are the kind of things that I think I could have a unique voice to. And they
Why do you
say,
think you get tabled? Why does it get tabled?
I don't know. I don't know. I really have no explanation for it, but they say, oh, it should be the state that's doing it. But Suffolk County has led a lot of health issues in the past. We were the first to pass Tobacco 21. And there's things that can be done if the legislature will push hard enough that will keep our children safe and improve their health and well-being.
I admire you because I can't stomach the policymakers. These are all common sense initiatives.
Mhm.
Really controversial. Who wants a 2-year-old doing gummy bears with marijuana? No
Right.
one.
Why wouldn't you do something that they're most vulnerable?
It's not a Democratic issue. It's not a far right issue. It's not a far
That's
left.
exactly right.
It's not an anti-Semitic issue. It's not
Yeah.
a Muslim issue. It's
Right.
not a person, a white, a Latino issue. It's common sense.
Like, I go into an exam room, I don't know the political party of that patient, nor do I care, right? I want to be an advocate for that child and that family. And that's what I would do in the legislature. That's just how my brain works. As a pediatrician, we're there to help people. You're not there to overrun to power people.
It's about common sense, right? I have common sense. We've lost it.
Yeah.
And I just get so frustrated. I think you've seen, Dr. Eve, some of my frustration sometimes is you talk to them, and they're like, yeah, thanks for letting us know.
Yeah. And it's, you know what, just you have to keep at it. I would spend countless hours during COVID when we were really, in the height of the pandemic, we're really trying to encourage the vaccination. And I would spend so much time with families and patiently because I knew what the misinformation that they were getting from their friends on social media. And I'd ask them, please tell me what it is that's holding you back. What is it that you've heard? And we didn't get paid for this time, right? Just sitting there for half an hour with the patient, just really trying to counter their concerns, countering this information. And it might not work one time, it might not work twice, but it's about messaging and it's about patience and about just getting the right information out there and sharing
Yeah.
it.
I used to go into the exam room and be a little more open-minded and empathetic. They were smoking a little pot here and there. I drank beer in high school because the drinking age was 18 and everybody drank at 16.
Mhm.
Nobody seemed to really care. And I turned out to be a pediatrician, so not too
Mhm.
terrible. But today I just walk in and I see the 12-year-old and I go, I'm going to give you one message. If you see something that doesn't come from my prescription pad through the pharmacy, it could be laced with fentanyl. You may be dead. Even
Yeah.
if you need to use it, you're just in the wrong room at the wrong time. Inhale it, you're dead.
Yeah. No, it's very dangerous. The world that our children are growing up in is a much more dangerous place than we're often.
The moment that you see something that is not from a pharmacy, that wasn't given to you a prescription, run as fast as you can in the other direction because you don't know what's in there. You don't know how fast you're going to die. And I cannot bring you back from the dead. I undo a lot of things, but bringing you back from the dead is not in my toolbox.
Yeah. I think with the vaping, especially the kids, they see it all over the place. It's on the school bus. And they don't see it as a problem.
Right.
They hear a story of a friend. I mean, I could tell you we had a girl, she was 16, admitted around the time of early COVID. She was having respiratory distress. She looked like asthma, but wasn't asthma. The x-ray was like with that ground glass appearance, could have been COVID, but all the COVID tests were all negative. Do you do anything? No, we don't. No, we don't. Then finally somebody came in and she did vaping. She ended up going to the big children's center. She had severe fibrosis. Afterwards, she used to be an avid track player. No more running. She can't breathe.
Long term.
Yeah. So it's terrible. The
Awesome.
vaping is terrible.
And we need, as the adults in the room, we really need to do something about it. We really do. Here in Suffolk County, and New York State we banned the sale of flavored vapes, which I advocated for, but it's still happening. They're still selling these products to kids. And there needs to be better enforcement. There needs to be fines and threats to licensure if they sell to kids. These are problems. And the laws need to be expanded to people who are into flavored cigars and cigarillos. And those should be targets of legislation as well. We just really need to do everything we can to get these products away from our children. They're a short and long term goal.
Yeah. So this is my soapbox because it really troubles me. 50% of our children are on medicated chips. They're near or at the poverty line. I don't talk about food deserts, but more about they're exposed to poor food choices, which has a long-term damage to their well-being. They're failing in schools. Mental illness is a huge problem for our children today, as is obesity. And yet the funding is not there. In some states like New York, Medicaid pays 45% of Medicare. And many adult physicians will not see you on Medicare because they cannot make ends meet. Adult physicians will not see patients on Medicare because it's not enough for the work that they're doing.
And here
And,
we're seeing children with Medicaid, right? That's
and
At
in
half
New
the
York,
price.
at half the price of Medicare. Okay. And the policymakers and the politicians pat themselves on the back, but we're providing DEI and we're providing access. And you have an insurance plan now. It's called blah, blah, blah health plan. And it's like, how can you say that with a straight face? Why don't you fund the future of America?
Yep.
Because this is hurting all of us because it's simple economic. If that kid has mental illness, even if they don't die by suicide, which is the second most common reason why children die today, they're obese. They're not going to get a job. They're not going to pay taxes. They're not going to pay into Social Security. I'm not going to get a check when I retire from Social Security and democracy ends. So why don't they get it, Dr.
We
E?
understand that investing in our children is an investment in our future. And it is really troubling. And we as teachers know that children are undervalued in society, maybe because they don't vote and we have to be their voice. We've really advocated through my American Pediatrics chapter on behalf of this issue, particularly last year during the triple demic, right? We had COVID, flu, and RSV overloading our hospitals. Again, my husband, pediatric emergency room, they closed out the whole waiting room area and lounges. They were seeing patients sitting in chairs. They closed out their resident lounge where they all hung out to see patients in there. They became exam rooms. And it was unsafe. It was unsafe. And the reason for that be smaller hospitals no longer saw pediatric patients because they
Yes.
couldn't afford to. It was not cost effective for hospitals to see pediatric patients because they're paid so low for that, right? That's why you saw just children's hospitals being able to take these children, not having the capacity to do, creating dangerous situations for our children, for our patients, and it's just really troubling. And that's what it comes down to. It's an undervaluing of children in our society.
Yep.
And that was Nelson Mandela that said that you can judge a society by how they treat their children. Right now, we're not doing a great job because we know that if we look to protect their health and well-being, they're going to go on to be more successful adults, right? If we look after their health, if we look after their food security, after their education, they're going to grow up to be contributing members, happy members of our society. And we are failing them right now. And it starts with their health care. And it's a huge problem. You're absolutely right.
Remember back in 2018, 2019, where they passed that, I think it was PCRI mandate, where they obligated the Medicaid lines of businesses to pay at 100% of Medicare?
It was 2009 in the rollout with the ACA.
Okay, much earlier.
Obama,
That was great for
yes.
all pediatricians. And then what did they do? They wanted to have meaningful use, increase the number of Medicaid patients. Then came the districts, increase the catchment area and increase the safety net, get more and more Medicaid. We went from 20% to 50% Medicaid, if not more.
Yeah. And small practices can't afford
Against the
that.
state.
Yeah, well, yeah.
So there's multiple layers to that, right? So one good thing that ACA did with Obama and Biden is that in order for the states to get the match, they're going to pay some like 90% of the bills on all those new enrollees. They had to pay 100% of Medicare. That's how the law was written. But that sunset, I don't remember if it was 2 or 3 years afterwards, which is a
2 years
mistake.
later.
It
Yeah.
should have never sunset.
Yeah.
The other one is, and this is probably a pox, and I'm going to get a little political, but it's just probably a pox on some of the extreme right Republicans. The child earned credit at the
Right.
federal level lifts families out of poverty.
Incredibly successful. And it's just so sad. Yeah.
That's the beginning. I had a conversation with one of my Congress, the woman represents my district in the Congress. And we talked about all these issues we're talking about: maternity ward deserts, pediatric ward deserts, lack of pediatric specialists in the community emergency room, lack of capacity. God forbid if we had an H1N1 influenza outbreak, it mostly affects children.
Yep.
Children are going to die waiting for care in line at the emergency room that is already overburdened with mental health. that is in a children's hospital that barely can pay the bill is understaffed, underfunded, and exhausted. And that's the reality. And they're not acknowledging. And then I had to write her an email and said, I'm sorry, after I had the conversation with you, I realized that we need to get this earned income tax credit back for families, because that's one other strategy that would help me take care of my patients. But it's just multiple things, even just getting Coke and sodas out of the school systems. And there's so much work to do. And I'm so frustrated because
Right.
when I talk to the policymakers, they look like I'm a bat out of HELL. And they really, even at the beach, I had this conversation yesterday at the beach, and the guy that's sitting there is a little older than me, a couple of years older than me. He says, "No, you're wrong. 50% of our kids can't be on Medicaid.
We are.
No, you're wrong.
Yeah.
The number two cause of death can't be death by suicide in between the 10-year-old to the 25-year-old." I'm like, I am not. 40% of our kids are obese. I'm not wrong. That's the statistics. No one's looking. And he
So we
says,
have to keep pushing back. We have to keep, spreading the correct information. We have to show the supporting data. And that's why I think it's important for people like me to have that louder voice and legislator just to be able to spread
I
that
agree.
information.
And I
be
thank you
impactful.
for that. And I thank you for that, because we need this told over and over again till people pay attention and it changes. I have no idea, what is the county legislature in New York?
What is
What
the
is it?
county?
Legislature.
What is it in Suffolk County? There's 18 legislative districts. I'm in the 18.
Okay.
And yeah, you're overseeing the Department of Health, right? Mental
Okay.
health supports you're looking at the roads, you're looking at traffic patterns, you're looking at the water quality. And so there's, any number
Right.
of issues.
So it's not, so how many people are on like in Suffolk County? How many people get elected to this position?
There's 18.
So it's like here in Virginia, they call them county board of supervisors. So that's the same thing. It's just, and then you see what
There's a county executive that's like the mayor, and then there's that these 18 legislative districts. But the population of the county is like a small state. It's a very large county.
Okay.
Yeah.
And what is your biggest hope if you get elected that you will be able to achieve? How long is a term? How long is a term?
3 years.
3 years. And what do you
3
think?
years.
Yes, 3. And what do you think is the biggest impact that you hope to achieve on those 3 years?
I want to be a voice for health and being in children and families. And again, I think I bring an authentic and a unique voice to that. And there's a number of issues I'd like to address: the water quality infrastructure, mental health supports for our children. I think they need to be streamlined. When I send a patient, I can't do anything for my children suffering from mental health until they're suicidal, which we send them to the emergency room. They decide if they're suicidal or they're not, and they send them home with a piece of paper or a brochure. And if I want to get my patient before they're at that point, an appointment takes them months to get one. And when they get one, it's $250 an hour. So we're failing our children with mental health. We have to start treating it like any other medical problem and taking care of our children, because they are really suffering right now and seeing it so much every day. There are affordable sources out there, but they need to be streamlined and accessible. And we need to work on ways to make them more affordable, to incentivize mental health providers, social workers to live in Suffolk County, because we have a dearth of those kind of providers here. And we have to try and do a multifaceted approach to this issue, because our children are desperate for this kind of help right now. Again, the vaping crisis, I really want to address that and do more to enforce that and keep products out of the hands of our children. And I want to be a voice again for embracing our diversity and a voice against hate and bringing people together. Those are the kind of issues that stick up foremost in my mind. And I think, again, children can't vote, but we can, and we have to be their voice.
Yeah. And when is the election?
November 7th.
So,
And there's early voting right now in New York State every day from now through next Sunday. So do that as well, because we never know what's going to happen election day. Get stuck on a train, there can be a storm, feel sick. Just get that vote out early.
I wish you the best of luck and thank you for the advocacy piece. I know you're a great pediatrician, but I think the advocacy piece is a lot harder job than being a pediatrician. And
Very fulfilling. The advocacy, I love, like I said, I love being a pediatrician, but just when I made the connection between advocacy and pediatrics, it just occurred to me that when we check a lead level and the level of the lead that triggers a home search for the Department of Health to see what the source, that's law, right? When we give certain vaccines, which vaccines we give, that's law. And at some point, something clicked and I had an epiphany. Oh, everything I'm doing, most of what I'm doing, it's not just because it's recommended by the American Academy of Pediatrics, it's because it's law. And meanwhile, we have people in legislators at every level of government making laws about health and science that they have no experience in at all. How does that make sense? So it's just, I think it's a needed voice. And that's it's given me an extra level of fulfillment to be able to advocate for children on a different level than I already doing every day as a pediatrician.
Thank you for that. And we wish you the best of luck, not only in
Yeah.
your political career,
Yeah.
but also continued success in the practice because we need pediatricians to stay in the game.
Hopefully, you'll be able to convince people at the county level or wherever that pediatricians are valued, children are important. And if, as Dr. Bravo says, without pediatricians, nurses, and school teachers, if they're not valued, you'll have no future. And pediatricians will have no future if they're paid like they were paid when I started in 1996. It's terrible.
Campaign, you can go to dreevemeltzer.com and read more about me there.
Okay,
Uh,
great.
Thank you for your time this morning.
Thank you, guys.
Pediatric Executive Development System, or PEDS, is a dynamic, transformative program designed to accelerate the growth and development of the leaders in the field of pediatric entrepreneurship. PEDS takes a hands-on approach to problem solving, addressing real-time situations within your organization. More than a theoretical course, it is a practical platform that accelerates learning. Look at our link on the show notes for more information.